Okay, welcome. Good afternoon. My name is Bill Riviere, and I'm the State Safe Routes to School Coordinator from NJDOT's Bureau of Safety, Bicycle, and Pedestrian Programs. As the SRTS Coordinator and manager of our local planning assistance program, my work is all about improving safety and accessibility for people who walk and bike. I work with New Jersey municipalities on plans for improved bicycle and pedestrian circulation. I work with our TMA partners to educate children on how to walk and bike safely, and have spoken at senior centers across the state, teaching about traveling safely as we get older. Worked in the bike ped world for over 20 years, and I'm amazed at how far we've come and all the improvements that we continue to make. Now, in today's session, titled Safe Routes, Safe Roads, Safe Systems, we'll discuss the intersection between Safe Routes to School, Zero Deaths initiatives, and the Safe Systems approach, and how they are increasingly informing safety plans and street designs to improve conditions for walking and bicycling and ensuring safer streets for all of us. Before we get started, please note that the session is being recorded, and after the Academy, the recordings of this and all the other sessions will be made available online. I hope you enjoy the session and join us for our last session on September 28th from 12 to 1:30. If you haven't already, register at the saferoutesnj.org website. With that said, I'll now turn it over to our esteemed moderator, Sean Meehan. Sean?
Thank you, Bill. Good afternoon, everybody. My name is Sean Meehan, and I'm the Research Project Manager of the New Jersey Safe Routes Resource Center, which assists public officials, transportation and health professionals, and the general public in creating a safer and more accessible walking and bicycling environment through primary research, education, and dissemination of information about best practices in policy and design. I'm excited to introduce today's panel as we explore the intersection between Safe Routes to School, Zero Deaths initiatives, and the Safe Systems approach. Our session will start with Sam Rosenthal, a research project coordinator working as part of the New Jersey Bicycle and Pedestrian Resource Center at the Voorhees Transportation Center. Sam will give an overview of Zero Deaths initiatives and the Safe Systems approach. Sam will be followed by Amy Kaminski, Technical Programs Manager with the New Jersey Division of Federal Highway Administration, who will discuss the U.S. DOT National Roadway Safety Strategy. After Amy, we will hear from Elise Bremer-Nei, Bicycle and Pedestrian Coordinator at the New Jersey Department of Transportation, who will discuss New Jersey's Strategic Highway Safety Plan and highlight actions that most strongly align with the Safe System approach. Following Elise, we will hear from John Dugan, a research project coordinator working as part of the New Jersey Safe Routes Resource Center at the Voorhees Transportation Center, who will provide a brief overview of the New Jersey Safe Routes School program and set the stage for our final speaker, Cheryl Kastrenakes. Cheryl Kastrenakes is the executive director of the Greater Mercer TMA. Cheryl will be highlighting Safe Routes to School as a method for addressing safe systems approach and providing examples from the work of her TMA. Now let's get started by turning the presentation over to our first speaker, Sam Rosenthal.
Thanks, Sean. And good afternoon, everyone. As Sean mentioned, my name is Sam Rosenthal. I'm a research project coordinator at the New Jersey Bicycle and Pedestrian Resource Center, which is part of the Voorhees Transportation Center at Rutgers and funded by NJDOT. In today's presentation, I'm going to talk about some of the major road safety initiatives being discussed and implemented across the United States, including the Safe System approach and Zero Deaths initiatives like Vision Zero, Towards Zero Deaths, and Road to Zero. I'm going to discuss how these initiatives interface with each other and work in concert with the Safe System approach to advance traffic safety, especially for vulnerable road users. To start, I'd like to show this diagram, which illustrates the relationship between the main Zero Deaths initiatives in the US, the Safe System approach, and another road safety initiative, Complete Streets. Zero Deaths initiatives such as Vision Zero, Road to Zero, and Towards Zero Deaths set forth a goal that no deaths or serious injuries are acceptable on our nation's streets. The Safe System approach outlines strategies to help achieve this goal. It takes into account the safety of all road users, but especially those who are most vulnerable to death or serious harm in the case of a collision, such as bicyclists and pedestrians. Complete Streets, meanwhile, provides a method to reach the goal of zero deaths. Complete Streets policies focus on designing streets that enable all users to travel safely and support efforts to reduce fatalities and serious injuries. I believe Amy will be addressing the principles of the safe system approach in more detail in a few minutes, so I'm just going to briefly introduce it here. The safe system approach is an internationally recognized and successful practice that sets an ethical imperative that no one should die or be seriously injured on roadways. Rather than focusing on changing human behavior and preventing all collisions, the safe system approach refocuses transportation system design and operation on anticipating human errors and reducing impact forces to minimize crash severity and save lives. The safe system approach aims to achieve continual improvements in 5 system areas: safe road users, safe vehicles, safe speeds, safe roads, and post-crash care. As I mentioned, there are 3 prominent zero deaths initiatives in the United States today: Vision Zero, Towards Zero Deaths, and Road to Zero. These 3 initiatives are working at the national, state, and local levels to eliminate traffic-related fatalities across the United States. And I'm going to discuss each one a little bit more here. So Vision Zero is a strategy to eliminate all traffic fatalities and serious injuries while increasing safe, healthy, and equitable mobility for all. The Vision Zero approach is both proactive and preventative, seeking to position traffic safety as a public health issue. First implemented in Sweden in the 1990s, the Vision Zero approach has since spread throughout Europe and is gaining traction in many American cities. Vision Zero differs from the traditional approach to traffic safety in several ways, but 2 are particularly important. The first is the belief that mistakes are inevitable, and the roadway system should be designed to accommodate human error so that crashes do not result in serious injuries and deaths. The second is a recognition of the complexity of the problem of road safety, which includes factors such as roadway design, vehicle speeds, behaviors, technology, and policy, and the need to adopt a multidisciplinary approach that brings together local traffic planners and engineers, policymakers, and public health professionals to identify strategies to eliminate fatal and serious injury crashes. Vision Zero is rooted in the belief that everyone has the right to move safely in their communities and no one should be killed or seriously injured in a crash. This concept goes hand in hand with the safe system approach, which is based on the idea that humans make mistakes, but that those mistakes should never result in serious injury or death. Like the safe system approach, Vision Zero addresses road design, vehicles, and speeds to create a transportation system that proactively accommodates human error in such a way that when crashes do occur, no one is seriously injured or killed as a result. The second Zero Deaths initiative is Towards Zero Deaths, which is described as, quote, a national strategy on highway safety to advocate for eliminating serious injuries and deaths on our nation's roadways, conceptualized by safety practitioners, researchers, advocates, and others from a variety of disciplines. The strategy calls for all stakeholders to champion the idea that one death on our nation's roadways is too many, and we must all work together to bring the annual number of roadway deaths down to 0. The Towards Zero Deaths initiative originated at a highway safety workshop in Savannah, Georgia in 2009, and it grew out of a desire to establish a national highway safety vision. The Towards Zero Deaths national strategy, released in 2014, identifies 6 core emphasis areas. First is drivers and passengers, which involves changing driver behavior through education, enforcement, messaging, and technology. Vulnerable users, which includes improving vulnerable road user safety through infrastructure, planning, enforcement, legislation, and education. Vehicles and vehicle technology. Infrastructure, which entails upgrading infrastructure, employing technology, and improving design. Emergency medical services, including improving 911 access, response time, on-scene medical care, and transport to hospitals. And safety management, which involves encouraging stakeholder collaboration, improving data collection and analysis, and providing a knowledgeable workforce. Overall, Towards Zero Deaths and its national strategy emphasizes the creation of a culture of traffic safety where drivers will reject risky behaviors and all road users will make decisions based on safety. Towards Zero Deaths sees itself, Vision Zero, and Road to Zero as complementary programs that support the shared goal of safe mobility for all people. The last Zero Deaths initiative that I want to mention is Road to Zero, which is a collaborative effort focused on eliminating traffic fatalities within 30 years. Road to Zero is essentially an umbrella organization that allows other efforts, including Vision Zero and Towards Zero Deaths, to collaborate through a steering group. Road to Zero began in October 2016 and is led by the nonprofit National Safety Council in partnership with the U.S. Department of Transportation. A comprehensive report laying out strategies to reach zero roadway deaths by the year 2050 was released in 2018. The report identifies three main initiatives to achieve this goal. First, doubling down on what works through proven evidence-based strategies. Second, advancing life-saving technology in vehicles and infrastructure. And finally, prioritizing safety by adopting a safe system approach and creating a positive safety culture. The Road to Zero report highlights the near-term importance of strengthening and enforcing traffic safety laws and supporting safety researchers and transportation system designers with resources. In the long term, the Road to Zero strategy relies on new technologies and partnerships between public safety and health groups and industry professionals to accelerate safety benefits. At the same time, the report notes that employing existing technologies and policies, namely Vision Zero and the Safe System approach, can achieve the goal of zero roadway deaths and serious injuries. The report identifies both a culture of safety and the Safe System approach as, quote, potentially powerful tools for achieving the changes needed to reach zero roadway deaths, and promotes both Towards Zero Deaths and Vision Zero as important strategies in this effort. So this table shows the degree to which each of the three zero deaths initiatives I just mentioned references the safe system approach. So when it comes to Vision Zero, the safe system approach is actively referenced in literature and is a significant part of the strategy. Vision Zero emphasizes a safe system approach and focuses on influencing system-wide practices, policies, and designs to lessen the severity of crashes. In the Towards Zero Deaths national strategy, the safe system approach is not mentioned. However, the initiative's 6 key areas are similar to the 5 elements of the safe system approach. And like the safe system approach, Towards Zero Deaths encourages a transportation safety culture in which any death or major harm is unacceptable. Road to Zero's literature actively references the safe system approach as well as the Vision Zero and Towards Zero Deaths safety strategies. And one of Road to Zero's 3 main initiatives is to prioritize safety by adopting a safe system approach and creating a positive safety culture. So while all 3 Zero Deaths initiatives identify the same central problem, each one takes a slightly different approach with a distinct focus. Though each initiative references the safe system approach to differing degrees, more recent literature from all 3 initiatives has been updated to more specifically align with the approach. And it is likely that this alignment will only strengthen as the FHWA continues to release safe system approach guidance. Finally, while all 3 Zero Deaths initiatives set a goal of zero roadway fatalities, the safe system approach provides a framework and strategies to reach that goal. Recognizing the importance of addressing multiple factors in achieving a safer and more accessible road system for all users, the safe system approach takes a broad view of the road transport system, focusing on roadway design and speed management, and using proactive data collection and analysis to further equity goals. So if you're interested in learning more about the Safe System Approach and Zero Deaths initiatives, we have 2 reports on the New Jersey Bicycle and Pedestrian Resource Center website on this topic. So you can visit njbikeped.org to read those reports and learn more. And I also just want to plug the website in general. We have, beyond just those 2 reports, a lot of research reports and resources that advance our mission of assisting public officials, transportation and health professionals, and the public to create safer and more accessible places to walk, bicycle, use wheelchairs, scooters, and other micromobility devices. So please visit our website and learn more about the resources we have there. And finally, here is the contact information for both the NJ Safe Routes Resource Center and the Bicycle and Pedestrian Resource Center. And I'll turn it over to Amy now. Thank you.
Thanks, Sam. I appreciate the introductions. And I do want to point out that there's quite a few similarities between what Sam was just presenting and what I'll be talking about. So I'll be covering the National Roads Safety Strategy and the Safe System Approach and how they're intertwined. So the NRSS and the Safe System Approach looks at, well, I guess we should start with our disclaimers first. Federal Highway always requires that we share this disclaimer whenever we do presentations. If we could move to the next slide. We know that there are thousands of lives that are lost every year in the United States. We know since the pandemic that there has been an increase even more in traffic fatalities across the board. Next slide. Looking at this, we know it's a national roadway safety problem, and it's not just with vehicle traffic. We're seeing pedestrian deaths are increasing and bicycle fatalities are increasing. Next slide. In New Jersey alone, we can also see that the fatalities have been relatively flat for the last 15 years, and we haven't seen a significant decrease in traffic fatalities. Looking at the trends for the pedestrian, bicycles, and all fatalities, it's been fairly consistent. However, pedestrian fatalities in the state of New Jersey have been increasing looking at trend lines. We know that this is definitely a national challenge and mentality, and we need to do something. We need to transform how we think about road safety. Isn't it obvious to you and to myself that everyone should be able to leave their home and know that they're going to arrive safely? Can we imagine that our country as a whole, where nobody has to die from vehicle crashes, not only today, but throughout the entire year? Well, what we know is it's going to take some effort on everyone's part to reach that. And that's what we're talking about with the Safe System Approach. So the National Roadways Safety Strategy was adopted in January of 2022. It was basically setting forward a vision and goal. Next slide. Adopting the Safe System Approach, which has already been introduced by Sam, and creating new priority and actions to the existing practices. We also incorporate equity and climate goals within the National Road Safety Strategy. So with those visions and goals, the United States DOT adopted the Safe System Approach. Next slide, please. Identified new priorities and action items and called all stakeholders to action on the Safe System Approach. Next slide. So this is going to require that we have a paradigm shift so that we can improve the safety culture in our society, so that we can also ensure that we have collaboration across all the safety stakeholders, not only in system design, but looking at operation and incorporating and understanding that humans will make mistakes and doing what we can to lessen the impact forces or kinetic energy to create, to reduce the crash severity and potentially save lives. So this approach aims to eliminate those fatal and serious injuries, again, by accommodating the knowledge that we know humans make mistakes and keeping those impacts we need to keep within tolerable levels. Next slide. Around the world, since the year 2000, many countries have adopted the Safe System Approach. As you can see, we have seen fatal crashes being reduced all around the world, whereas we've had little or no reduction in the United States. This is based on the knowledge that these countries, Norway, France, Sweden, and Netherlands, and Australia, have adopted the Safe System Approach, which requires everyone participating together with adopting it. Next slide. So that Safe System Approach was already discussed by Sam, and the fact that it is complementary to the Road to Zero, Towards Zero Death, and the Vision Zero networks. which has been adopted across the country. Next slide. So this is a graphic that provides an overview of the safe system approach, looking at the same key components, which will be explained in a little bit more detail. The principles that are involved are that death and serious injury is unacceptable. Humans make mistakes. Humans are vulnerable. The responsibility for a safe system is a shared approach, and safety is proactive. We also want to put in redundancy to make sure that if one of these systems fail, another one's there to potentially keep somebody from having a fatal crash. Next slide. So these are the different elements within the safe system approach. It's safe roadway users, that you and I, and anybody that uses the facilities, safe vehicles, safe speed, safe roads, and post-crash care. Combining all the conduits, such as the safe system elements, we can ensure that everyone reaches their destination safely. So where are you on your safe system journey? I believe that this is just showing what the traditional approach was over the years and how it's being changed to look at through the safe system lens. Next slide. We know that if we all work together and do it right, we're going to save lives. The nature of good, safe work is that we don't know the names of the people whose lives will be saved by these efforts. But we do know that Americans who might otherwise have been an empty seat at the dinner table will instead be right where they belong. And who knows, the lives that you act to help save just might include your own. That's an important message. The next slide, please. Have your cameras out if you're interested in looking into the National Road Safety Strategies or the safe system approach to see what you can do to participate. The information is there for you to look at and review. Thank you so much. We'll move on to the next speaker.
Okay, great. Thanks, Amy. Next, we'll hear from Elise Bremer-Nei.
Good morning, everybody. My name is Elise Bremer-Nei, and I'm the Bicycle and Pedestrian Coordinator at the New Jersey Department of Transportation. I work in the Bureau of Safety, Bicycle, and Pedestrian Programs with Bill, who you met earlier. Our bureau is located on the planning side, but we work closely with almost every other unit within the department, as well as with many, many stakeholders outside of NJDOT. My office is made up of a team of experts on bicycle and pedestrian issues. We assist with reviews of projects on state roadways for compliance with the department's Complete Streets policy, and we provide subject matter expertise to state, regional, county, and local projects with bicycle and pedestrian components. We also assist with the distribution of federal funds to local bicycle and pedestrian projects through the Transportation Alternatives Set-Aside and the Safe Routes to School grants administered by NJDOT's Division of Local Aid and Economic Development. Another program we administer is Local Bicycle and Pedestrian Planning Assistance. Our work is funded by the Federal Congestion Mitigation and Air Quality, or CMAQ program, and we are able to provide planning services to communities through our on-call consultants to improve the environment for people who travel on foot, on bike, or transit for free. People who walk and bike are the most vulnerable roadway users and are more susceptible to being killed or seriously injured when they're involved in a crash. In New Jersey, fatalities among pedestrians and bicyclists as a percentage of all traffic fatalities consistently exceed nationwide rates. Between 2018 and 2020, pedestrians and bicyclists together accounted for about 1/3 of all traffic fatalities in New Jersey, higher than nationwide rates of about 20%. Now, crash data analysis shows that 12% of pedestrian and bicycle fatalities and serious injuries were recorded as hit and run crashes. That means that out of every 10 drivers who injured or killed a bicyclist or pedestrian, one of those drivers left someone lying in the road. With hit and run situations, it's likely that the driver was doing something they shouldn't have been doing, but we don't know if they were speeding or driving impaired, distracted, or unlicensed. In addition, you can see another 24% is categorized as unknown. We have no information on the factors involved in some of these crashes labeled unknown. This lack of complete data impacts how we categorize these incidents, and that impacts how we prioritize funding to fix these problems. Almost a quarter of crashes where pedestrians were killed or seriously injured happened at signalized intersections. For some of the other categories, reporting has been flawed for crashes where pedestrians were crossing at an unmarked crosswalk at an intersection or a mid-block location. And there are almost always stories behind the data that the NJTR1 form doesn't allow a responding police officer to record. For example, that the pedestrian didn't have much of a choice when they attempted to cross at mid-block because an intersection or cross street was not available for a long distance. Crash statistics for pedestrians and bicyclists show that risk is not evenly distributed. Crashes resulting in fatalities and serious injuries disproportionately affect certain groups, including minorities and people with disabilities. This graph shows that fatalities and serious injuries were highest for pedestrians and bicyclists in the 65 and older age range, and higher for men compared to women. Crash records give you a victim's age and gender, but they don't tell you about their education, income, level of transit dependency, or if they're living with disabilities. We need to do a deeper dive into the data if we want to see all of the factors that go into crashes involving people walking or biking, and if we want to know how to prevent them. NJDOT is working with its partners to reduce the number of pedestrian and bicycle fatalities through the Strategic Highway Safety Plan, which was released in 2020. The plan recognizes the value and incorporates best practices of the Safe System approach and other zero deaths initiatives such as Vision Zero and Road to Zero. All of these initiatives are built upon the principles of not accepting any loss of life, designing a transportation system that accounts for human error on the part of pedestrians and bicyclists as well as drivers, and prioritizing safety over other goals. If we look at all the factors of who is seriously injured or killed on our roads, New Jersey's 2020 SHSP also aligns with zero deaths initiatives and the Safe System approach by recognizing the need to create an equitably safe transportation network. Equity in transportation decision-making considers the diverse segments of the population, which may be unduly impacted or historically underrepresented in the transportation decision-making process. Equity in transportation seeks fairness in mobility and accessibility needs of all community members. It includes evaluating circumstances that impact a community's mobility, connectivity, and safety in determining the measures needed to develop an equitable network. And it recognizes the importance of providing traditionally underserved communities access to opportunities. We want to ensure that highway safety investments are inclusive of the interests of traditionally underserved or overburdened populations. So this includes using data to identify these groups of people. The 2020 SHSP included, for the first time ever, equity as one of the emphasis areas. The plan also includes a pedestrians and bicyclists emphasis area with a goal to simply eliminate pedestrian and bicyclist fatalities and serious injuries on all public roads in New Jersey. The pedestrian and bicycle emphasis area includes 18 recommended strategies and actions to be implemented over a 5-year period. Implementation relies on partnerships and coordination with other emphasis area teams. Round 1 of this SHSP included 5 priority actions for the pedestrian and bicycle emphasis area. First, establishing a Complete Streets task team to improve Complete Streets integration in all roadway projects. Assessing best practices for automated speed enforcement and vulnerable road user laws. Recommending strategies to improve pedestrian and bicycle design guidance. Developing a strategy for implementation of the Street Smart campaign across the state, and identifying high usage transit stops with large numbers of bicycle and pedestrian crashes in areas of transportation inequity so that we can prioritize locations for improvements. These actions resulted in a number of reports and resources aimed at improving safety for pedestrians, bicyclists, and other vulnerable road users. 2 reports, one on automated speed enforcement and one on vulnerable road user laws across the country, are available right now on the New Jersey Safe Routes Resource Center website. NJDOT began work on round 2 priority actions from the 2020 plan, including 5 from the pedestrian and bicycle emphasis area. Those included investigating best practices for accommodating vulnerable road users on arterial roadways, working on outreach on recent legislation related to pedestrians, bicyclists, and scooters, addressing how best to share crash data among jurisdictions, looking into school zone speed enforcement, and developing guidance for traffic safety education in our schools. One of the outcomes of round 2 so far has been with the new legislation for New Jersey's Safe Passing Law. Action team members contributed to a Safe Passing Law implementation plan that lays out a set of recommended actions to increase awareness about the Safe Passing Law, including recommendations for updates to the MVC driver manuals and state agency websites. Motor Vehicle Commission has approved all the recommended edits and is working to include them in the next driver manual update, and NJDOT and MVC have both been able to revise a lot that is on their website regarding pedestrian safety legislation. To read the full Strategic Highway Safety Plan, you can visit the website at saferoadsforallnj.com. In addition to the ongoing SHSP actions, I'd like to mention a few other priority projects that the Bureau of Safety, Bicycle and Pedestrian Programs is working on this year. One of our bicycle and pedestrian consultants, Michael Baker, is assisting us with an update to our pedestrian safety management system list. This list takes into consideration factors like fatal and serious injury producing crashes, traffic speeds and volumes, land uses, and distances between roadway crossings to generate a list of intersections and 2-mile segments where pedestrian safety is a concern. We check to see if these problems are being addressed in existing DOT projects, and if not, we generate problem statements to develop those projects. We're also just finished developing a bicycle safety management system list. In the past, we generated a list of roadway segments and intersections that might have bicycle safety concerns based only on crashes, and now we incorporate all those other factors like those used in the pedestrian system list. As part of the as part of the Bipartisan Infrastructure Law, also known as the Infrastructure Investment and Jobs Act, or IIJA, a special rule was established that includes a new requirement for states to complete vulnerable road user safety assessments. Michael Baker has been assisting NJDOT with an analysis of 5 years of reported fatal and serious injury crashes involving cyclists and pedestrians, and this analysis is feeding into our vulnerable road user safety assessment. One of our safety consultants, HDR, is assisting us with this assessment, and it is due to FHWA in November. I also want to announce that the New Jersey Complete Streets Summit will be held in person at the Rutgers College Avenue Student Center in New Brunswick on Wednesday, November 1st. The morning sessions will also be live streamed. The Safety Summit will be held in person at the College of New Jersey on October 24th. So I'm going to end with my contact information. Please feel free to reach out with any questions. And thank you for attending this session. Thank you for your interest and your dedication. And thanks to everybody who's part of the Bicycle Pedestrian Emphasis Area team, working on each strategy and action for the New Jersey Strategic Highway Safety Plan. Thank you for all of you who are working on Safe Routes to School. Your work is invaluable to the department and to all of the people of New Jersey.
Thanks, Elise. Right, next we'll move on to John Dugan.
Good afternoon, everyone. As Sean said, my name is Sean Dugan. I'm going to give you an overview of the New Jersey Safe Routes to School program and the work that we do here at the Safe Routes Resource Center. Next slide. Okie doke, here we go. The Safe Routes program is a federal, state, and local effort that creates safer and more appealing conditions for walking, bicycling, and using other wheeled active transportation devices as a healthy part of everyday life by focusing on the overarching goal, which is where it's safe, get youth, including those with disabilities, walking, bicycling, and rolling, and where it's not safe, make it safe. The aim of the program is to foster healthy and active lifestyles from an early age and facilitating the planning, development, and implementation of projects and activities that will improve safety for people of all ages and abilities from all backgrounds and neighborhoods and reduce traffic, fuel consumption, and air pollution. Pretty much a lifetime of being active begins on the way to school. Safe Routes for All provides safe and equitable access to active transportation for people of all ages and abilities from all backgrounds and neighborhoods in New Jersey. The NJ Safe Routes mission is to partner with schools and communities to help prioritize and implement opportunities for people to walk, bike, or travel by other wheeled devices. And by focusing on the improvements to support active travel, we believe that we can create conditions that are safe, healthy, equitable, and appealing for all. So I'm going to explain the three pillars of the program. New Jersey's Safe Routes to School program has three pillars, and the first one being the 8 Transportation Management Associations, or TMAs. I'll probably use that acronym going forward. And these are they have different service areas that cover the entire state, as you can see in the chart here. Some counties are split into multiple TMA service areas, and to find the regional Safe Routes to School coordinator who serves your community in your town, visit saferoutesnj.org/findyourSRTS regional coordinators. And I'll go into that a little bit more. Basically, what the Safe Routes to School coordinators offer is a free technical assistance to schools, school districts, and municipalities in Safe Routes program and communities from all 21 counties. So what they do, you can look on the slide too, but what they do is they offer free assistance with walk and bike events, bike and ped safety education, school travel plans, walk and bike assessments and audits around the schools, Safe Routes recognition program applications, and I'll get into that a little bit later in my presentation. Supportive policies for walking, bicycling, and complete streets. They help with sustainable Jersey for school points, and other innovative programs and projects to, once again, help support safe walking and bicycling to school. The New Jersey Safe Routes Resource Center at Rutgers University is the other pillar of our three pillars. Basically, what we do is assist public officials, transportation and health professionals, and the general public in creating a safer and more accessible walking and bicycling environment through primary research, education, and dissemination of information about best practices in policy and design. Our role includes supporting the development of policies and procedures and providing education, outreach, and training to those Safe Routes regional coordinators and local champions interested in implementing some of the programs I discussed before. The program goals through the NJ Safe Routes to School Resource Center include educating about safe walking and bicycling, prioritizing health and equity, nurturing partnerships, implementing safe, accessible infrastructure, and developing and disseminating research and best practices. Among the resources, the center also provides and includes finding your TMA Safe Routes to School coordinator, grant information, safety lesson plans, how-to and case study videos. We also have a robust YouTube channel, crossing guard resources, design guides, policy documents, research studies, and help desk. And if you're interested, sometimes this is a question in the Q&A, I don't know if it popped up yet, but the crossing guard training resources can be found at njcrossingguards.org. So I said before, I mentioned Sustainable Jersey. The Safe Routes Resource Center recognizes municipalities and schools, public, private, or charter, for their commitment to the Safe Routes to School program. Through the state Safe Routes recognition program, the recognition program has 4 levels. Those are first step, bronze, silver, and gold. Each level includes activities that support safe routes to school for schools and municipalities. So we have actions for both school and municipalities. The Safe Routes program also has ties with Sustainable Jersey. For example, the Silver Level Recognition Award automatically gets you Sustainable Jersey points for their Safe Routes action. If you're not aware of Sustainable Jersey programs and actions, I recommend that you visit their website, sustainablejersey.com, and check out their resources and actions. Staff at the Safe Routes Resource Center review all of the bicycle and pedestrian related actions for Sustainable Jersey and Sustainable Jersey for Schools. It's not just staff, it's actually me and one other person look at it. So I will be looking at them if and when you apply. The third pillar of the Safe Routes to School program, we saved the best for last, right? NJDOT. In addition to providing vision for the statewide program and funding of the TMA Safe Routes to School coordinators and the NJ Safe Routes Resource Center, NJDOT also offers a variety of grant funding opportunities directly to communities. When reviewing grant funding opportunities at NJDOT, they are divided into state-funded program and federally funded programs. Safe Routes to School and transportation alternatives are larger funding sources for bike and ped, as well as Safe Routes infrastructure projects. NJDOT also offers a growing collection of guides, including Complete Streets Design Guide, the School Zone Design Guide, and Bicycle Parking Guides, and the Complete and Green Streets Model Policy Guide. Each of these guides are a compilation of current best practices and support NJDOT's vision for New Jersey to be a place where people of all ages and abilities can routinely and conveniently bicycle and walk with confidence, safety, and security. If you're thinking about your projects and realizing you may need help with creating a larger bicycle or pedestrian plan, please keep in mind that NJDOT Borough of Safety, Bicycle, and Pedestrian Programs offers planning technical assistance through their local technical assistance program. To date, the office has funded plans in over 100 towns through their on-call consultant program. On-call consultants are paired with your town to help create the process and plan to improve conditions for walking and bicycling. If you're interested in learning more, please email at bikeped@dot.nj.gov. That concludes my presentation, and I will be here until the end, so any questions or anything, feel free to put them in the chat, and I will pass it over to Cheryl at Greater Mercer TMA.
Thank you, John. I appreciate it, and I appreciate the opportunity here to, I appreciate the opportunity here to be able to sort of do the wrap up for this session. And to really, what I really want to do is be able to bring home the importance for Vision Zero and embracing a safe systems approach. You've heard a lot of great information today, and I really want to emphasize, why this is so important that we have safe systems and the connection to safe routes to school. Next slide, please. Great. Well, to start, and you've heard some of this information before, but why safe systems? Why Vision Zero? The simple answer is we've got a traffic fatality problem. There are around 40,000 people are killed each year in the United States in motor vehicle crashes. It had been a little lower, but we're moving in the wrong direction. That's a little more than 100 people per day. In fact, I had to change this slide because I've used it before and it had 100 people per day, but with latest statistics, we're up to 117 people each day that are killed in motor vehicle crashes in the United States. And as you can see from the statistic too, and I believe Elise had mentioned it earlier, that bicycle and pedestrian fatalities in New Jersey are 30% of the motor vehicle crashes here in New Jersey. So, the problem with this is, the issue with this is that it's endemic, it's persistent. This is every year we're having similar numbers. And I personally think it's an acceptable number, and I'm sure that all of you feel the same way too. This is something that we would not accept for plane travel, on train travel, and yet, relatively speaking, there is very little outrage. And that's because most people think of these as accidents, that it's inevitable, that this is literally is just, the cost of doing business. We have normalized fatalities when it comes to motor vehicle crashes. And it's that kind of thinking that leads to the perpetuation of this problem. We're not thinking of it as being systemic. In general, we don't demand better safety from our road system, and that's really led to all these deaths and serious injuries. The expectation has continually been on making road users, be perfect, and that's impossible because we are human. Mistakes are inevitable, as you've seen from this mentioned earlier, and we need to change things. Next slide, please. So you've seen this exact graphic before, but just to reiterate that Vision Zero, it really is not a tagline. It is a different approach and a different way to approach traffic safety. And the key here is that we're shifting away from that idea that humans have to be perfect, and we need redundancy in our system. And that really is one of the key factors. So this graph of the safe systems approach is a little bit different than one you've seen. But this one really emphasizes the point of public health and its importance in Vision Zero. At the center of this is that human tolerance of crash impacts. That's what we have to be looking at. We don't want people killed. Safe systems, Vision Zero, is very much a public health approach. We're looking to work upstream. We want to prevent crashes and we want to prevent serious injuries and fatalities. We want to move away from the idea that they're going to happen, they're inevitable, we'll treat people when they get to the hospital. We want to work upstream. We don't want to see them happening at all. So I have this graph here because this kind of shows that where two countries diverged on their path to trying to reduce fatalities. So if we look at this picture of, this is the United States and Netherlands, if you look back into the early 70s, Netherlands was actually a little bit higher than we were. And it was a peak point. And you can see, if you look at this, we're both countries are trending downward here, because a lot of good things did happen along the way in terms of technology and making cars safer. Seatbelt laws were enacted, which also did a great job in reducing and protecting people inside the vehicles. But something really critical changed that has brought their deaths per million, and I think it was a great graphic that I think Amy showed, showing how much lower that they've been able to reduce their traffic deaths per million population. So what is it? So what happened? Well, there was, they peaked in 1971, and it turned out one of the children that had died there was a child of a journalist from a national newspaper. And he wrote an article with the headline that it was called Stop der Kindermord, which translates into Stop the Child Murder. Obviously not all children, and not everyone that was dying there were children, but it was about 500 children had died over the course of that year. And that, that headline brought attention. Activists, actually, I think it was actually a well-known activist there who was very influential, really came out saying, what kind of society allows this? And the first reaction from the journalist, what he put into the paper, was that the solution was, let's put all children on buses. But then with some thought and reflection from others that had worked in the field, there were activists towards it, they said, let's tackle this problem at the source and look towards where the problems are from. And we don't just put people on buses to prevent them from anything from happening. So what they ended up doing is they moved away from the whole idea that we continue to do wider, straighter, faster roads. And they started just saying, how do we make our roads more comfortable? They started thinking on that safe systems approach. And because of that change and shift, they were in the same direction as us. They really changed shift in thought. So it was a cultural shift and an expectation of what should be, and also in design. And that made a big difference. And you could see how we diverged. I think we are moving hopefully away from where we've at. That's why we're talking about the safe systems approach. And I just want to point out one other thing that also helped. It's just a point of fact that the 55 miles per hour speed limit had, I guess it was in 1974 or 1975, was done for the reasons for the gas crisis. But what they found was that when lowered the speed limit, about 4,000 people, 4,000 less crashes occurred. And that's about the amount that's been saved every year while that was enacted. So they kept it even when the gas crisis was over. Eventually it was partially repealed in the 80s and fully repaired by 1995. But again, safe speeds is part of the importance of this. So next slide. You've seen this before, so I'm not going to really go over this general idea, but again, I want to emphasize safe systems and that speed must be managed. And we could just move on to the next one. And I'm showing this speed one because I just want to really hit home, because I know there's something in safe routes that we emphasize as well. And I know all these things, that speed really matters. It is especially for vulnerable road users. The risk of severe injury or death increases as a driver's field of vision narrows. And you see here, not only is it more likely to get killed when you're hit by 20 miles at a speed of, at 20 miles per hour, it's 10% death risk. By the time you get to 40, it's 80. But a driver is dealing with not just speed, but also, having a narrower field of vision. It makes a big difference. We must address speed. So just wanted to I'm repeating things, but redundancy is what matters in safe systems. So we're going to keep hearing things. So next slide, please. So I want to talk about the connection. So that really hits home, I think, why. I mean, this is all, we have to start looking at this as being personal. Because every one of these people, they say 2 people a day in New Jersey are killed in motor vehicle crashes. And then someone might say that doesn't sound like a huge number, but it's 2 people that were 2 people's person. And that's what always has to stay at top of mind. But safe routes is part of the system that can help work towards addressing and getting us towards zero. So one of the ways, we have safe people. And that can be done through education. So with the safe routes to school, we do a lot of bicycle pedestrian safety education. And as I don't think I reintroduced myself, but I'm one of the Greater Mercer TMA. We are one of the TMAs that are working on the Safe Routes program. And the things that I am going to talk about are can be done by all the other TMAs. So we do bike safety pedestrian education, and they take place in the classroom. They could take place in the phys ed setting with health education. We want to address the driver's education. Do our drivers know do they know how to drive and think about speed and getting somewhere quickly as not being the primary goal? Do they know how to drive with cyclists and pedestrians? We do education at community events. We do it at libraries, summer camps, conduct bike rodeos, do walk to school events. And while we don't do this, there's crossing guard training that VTC does work with. So, and this picture here is from one of our walk to school events. Next slide, please. So here's just some of the safety presentations that just some photos just to kind of point out what can be done. The one you see on the left is a presentation at Bayhead. They can be done at all different settings. Like we said, we can do it in the classroom, like the one you see on the right. The one on the left was in a gym. I think like I said, we do them at camps. The one on the bottom right, I believe, is at one of the, I think it was a summer camp that was in Point Pleasant. So we do them in all different kinds of settings. We just have a photo of one of our slides here, what helps you cross. We're also doing another program now that ties in the environmental friendliness of walking and biking and teaching about through a transportation lens, the impact of vehicles and how, as a people-powered green machine, you can be helpful. And then it transitions into bike ped safety. So the kids are learning both lessons. So they understand not just that it's good to bike and walk, but they'll understand why someday when they choose it. Next slide. Bike rodeos are a very effective way of giving kids lessons on some of the skills for biking. We do them at schools, which is one you can see in the top middle there. That was one we do in collaboration with the police department. That one was in Point Pleasant Borough, and that we frequently end up participating with the police. And that's again, I think having that teamwork is really valuable. The one on the left here is one that we did in Trenton. We try to give kids the instructions so they understand, the importance of stopping, crosswalks, how to use a bike lane. So we go through the lessons. They learn how to use hand signals, turn left, turn right. It's a great community event. It can be great. It's wonderful. We've done in school. We've done them as part of farmers markets. So there's lots of opportunities. You're looking into your community. We're looking into now potentially partnering with one of the hospitals to do it as a community ed program. We also get out into the community. We have that, you can see that wheel there. We have our bike ped safety quiz wheel, we call it. But this is where we get to all the community. And they spin it, they get a question about bicycle pedestrian safety. So any touch that we could make is helpful. Again, classes being taken place in the library. In fact, this one is coming up still. So if you're in the Point Pleasant area, there's a class on October 14th. Next slide, please. So one of the other very important ways that Safe Routes works in this space is to get safe streets and safe speeds. And we do this largely through our school travel plans. So we work with the communities. Here, I just have a sample of a cover from one we did at Hopewell Elementary School Travel Plan. It's one of the more recent ones that we've done. But within those school travel plans, the TMA team working with members of the community to get others involved, whether they're from the schools, the town council, parents, whoever wants to participate within the community with us. And we look at existing conditions. What are the school settings? What are the travel conditions now? The picture that's in the top right, that's showing where there's all the sidewalks are mapped out, where are there missing sidewalk segments, where are there continental crosswalks, where are there crosswalks missing. So we know it's there. We look at the crash data. And then we do an audit. We do a pedestrian road safety audit where we walk the community. We look at those conditions. We come up with audit findings and recommendations that what the community can do, what the municipality can do. One of the things these school travel plans are a very important part of the Safe Routes to School grant program to get funding, which is open now, and I believe due November 17th. Please correct if that's wrong at the end of this. This is an important part. It lays out a plan for moving forward on what kind of projects you can put in to make things safer, to make the streets slower around schools, to keep them safer. And one of the things, I'm showing a picture on the bottom there because this was, it's actually in Princeton, and it's a improvement that was made. We did a school travel plan a number of years ago at this location. Sadly, there was a fatality there before all of these improvements came in, but now it's been improved. But within that travel plan was, putting in a flashing beacon, putting it, improving the crosswalk. There's housing on one side. It was a fast road. A number of improvements have been made to make it safer for kids to walk to school. I encourage all municipalities to reach out to the TMAs to do a school travel plan. It's good for within 2 miles of the school, which in general covers quite a bit of the school of a town's area in many cases. Just one other thing I'll mention here, I'm going to go on to it too, is innovation and demonstration projects. We'll get to later on. It was just on this, but next slide, please. And I'm not going to go through these proven safety countermeasures, but Federal Highway has proven safety countermeasures. We have a link to this at the end of every school travel plan we do, because again, they are proven safety countermeasures. And many of them work towards, as you saw, the roundabout, which was put in on that previous slide, to slow traffic down, road diets, all things that can help, that will work, that are going to be eligible for funding, and we know have large decreases in fatalities when they're implemented. Next slide, please. This last one I want to add is one that's a little bit different. There's a walking school bus, which many of you may have heard of. It's the idea of children walking to school with a parent or adult of some responsible charge in a group along a route to school. So during this past year, we've been working with the Trenton School District, who initially reached out to us with this idea. They had read about the walking school buses, and they wanted to do it not just for one school, but for all elementary, intermediate, and middle schools. So we were game to do it, but knowing that this was a bigger task and as a small organization, we could do solo, because that's a lot of walking for a lot of schools to track these routes. We reached out to the New Jersey Department of Transportation, contacted Elise actually directly on this one, and they were able to provide one of their on-call consultants to work with us on that. And then we reached out to the Trenton Police Department to assist as well. So we have a true team effort in making this happen. It is launched this September. What was done before we even got these maps that you see on the left out, we at the TMA, we mapped where crashes had taken place. We mapped the catchment areas for the schools. We had anonymized location data, so we knew where concentrations of students were living. And then we hit the streets, and we mapped them we mapped them first on paper, and then we walked those routes. Brought the police along with us for many of them, and they were able to add additional guidance. So we were able to look at the infrastructure as we walk the streets. Did it have the cross signals? Is this street going to be okay for crossing on? We had the police directing us to this might be a better option, this street, and then put all that together and made the final mapping along with route numbers and time points and little walking school bus tips. And there was one for every school in the district. Prior to this, we also had created a walking school bus app, which is open for all in New Jersey. So we had worked with them on also getting information for that out, gave marketing materials, created this logo. So trying to put it all together to make this a successful project. One of the things that I think is especially helpful is that we're able to tell the police, to tell the parents that the police are aware of these routes and they've been encouraged to keep an eye on them. So this way, we're looking to make the roads as safe as possible. But we're also getting feet on the street, and within that, there's safety in numbers. So that also makes the parents feel comfortable knowing there's more kids on certain routes, that the police have their eyes on the route. It's new. We don't know where it's going yet, but I think it has a lot of possibility, and it is certainly an important element of Trenton has with a wellness plan for the school district, and one of it is encouraging kids to walk. And so this is hopefully going to go a long way in helping to achieve that goal. So I just want to emphasize one more time how important the partnership is for this, because I think in the end, and this is really going to be my wrap on this, but what makes Vision Zero happen? What makes it, it's really all of us. I mean, every one of us is a road user. You may be an engineer or a planner or a parent or a local official, but every one of us is a road user and has the opportunity to at least be a safe road user. But we need to be safe people to be part of the safe system. We need to reach out to get all those involved to be able to really move these programs forward. And I think a collaboration like this and getting local partners really makes a big difference to help us move towards our goal of having safer streets, safer people, and zero deaths and fatalities. Thank you for your time. And I just have my contact information next. That's it.
Okay, great. Thank you, Cheryl. Thank you, everyone. It was great and great presentations. Everybody did amazing, and I learned a lot. So now we have time for some questions. So everybody, please put questions in the chat if you have them. And I also just wanted to follow up a little bit on some of the things Cheryl said, because I mean, that was an amazing presentation, Cheryl, and I really want to reiterate, if you're out there and you have not yet worked with your TMA, what are you waiting for? Reach out to your TMA, and if you're not sure who your TMA is, you can find them on the Safe Routes Resource Center website, which is saferoutesnj.org. And wherever you live or work in New Jersey, you are covered by a TMA, and they just provide so many excellent resources. And as Cheryl mentioned, just innovative ideas. So, the TMAs recognize that, local folks are the expert on what goes on in their community, and they want to work with the community, hear from the community, and then work together to pair, some of these innovative ideas to help solve some of the, the things that are worrying the communities. So it's really the great organizations, and if you haven't reached out to them, you should. And also, Cheryl, you had the walking school bus app on one of your slides. I just wanted to, that's available statewide for anyone to use, correct?
It is, yes.
So definitely check that out. It's a great tool and can help you locally organize walking school bus routes within your community.
And it's available in the app or the iOS store.
Great, thank you. That's one other thing, just because it was on my mind, that I'm glad you brought up too as well, Cheryl, was the bus everyone solution. Sometimes we hear that a lot in safe routes to school, that, the safest thing is just put everyone in a school bus. And it does not work out. So we actually, years ago, I remember speaking to someone who used to come to some of our safe routes to school meetings, and she actually championed that idea in her school district. And the first day it was in effect, basically said, oh no, what have I done? Because it just made traffic situations so much worse. And, students were late to school. Putting everyone on the bus isn't the solution. If a bus is available, if students do live too far away, that is a great option. But having everyone bus just isn't feasible. So I thought that was a great thing to bring up, Cheryl, because it's the first thing that pops into a lot of people's minds, and it's it's not the solution. So
It doesn't
right.
address a problem.
No, definitely. So thank you. All right. I am not seeing questions in the chat, but I have some questions. So I'll invite some of you to respond. So more than one of you, I believe, has mentioned that the Safe Systems approach has more of a public health approach. So it's public health related. So I was hoping someone could explain why that's so important. So if anybody's willing to take that one.
Well, it's kind of a long view. I mean, Safe Routes to School is not just about safety, because if we wanted to keep them all safe, like you said, we would either make sure everybody had a seat on the school bus, or, we would throw up a fence so they wouldn't cross the street in a certain area. But these kids still need to learn the rules of the road. They need to get out there and have physical activity in order to stay healthy. They need to be able to breathe clean air, and in addition to being kept safe during the day and on their trip to school. So there are so many other problems that can be solved health-wise and environmentally that you can't get by putting everybody on a school bus.
Definitely.
Cheryl, I just want to jump in too and say that here in Mercer County, when we, this is several years back now, when we really started talking more about Vision Zero, the first Vision Zero resolution that we had passed in Mercer County was from the Greater Mercer Public Health Partnership, which is a consortium of the local hospitals and all the public health officials, because when they heard about Vision Zero and what it was such an aha moment for them that this is such an upstream approach to safety, that we want to be preventative. And, I really think public health can really help lead the way also on making all of this happen, because they are big supporters. I mean, that is the key. You want to prevent and not have to treat.
Excellent. Yes. Amy, you had your hand up. Did you want to chime in?
Yeah, I just wanted to chime in and mention that looking at it from the emergency services point of view, lowering that kinetic energy can increase the number of saved lives. Also, having those emergency room participate in triage and understanding what you do for emergency services, the move over law, different things like that can actually help save lives too. So it's not always just about the personal health, but it's the general overall health and keeping people alive that needs to be considered.
Definitely. And I think that's just a great point too. One of the things I love the most about Safe Routes to School is that it is so broad and far reaching. I mean, our goals are basically to keep children happy, healthy, safe, and improve, their travel to and from school. It's hard to find people against that, but it touches so many different other interests, environmental interests, health interests, that it is just a great way to kind of build up a group and, get more things done. So that's great. Did anyone else have anything to add, or should we move along? All right, I have another question. So this one is a bit more, I think this is a bit challenging. So some aspects of pedestrian fatalities seem a huge challenge, not just some, I'd probably say most. But one of the things is like, the size of trucks and SUVs are getting much bigger and heavier, which is especially challenging when educating younger children about safety when they can't see over the hood of a vehicle. Do you have any thoughts on how to address this problem? That's a bit of a challenge for you all.
So, Sean, I'll jump in with, I'm not sure if you're talking about the problem of making the car smaller or making children aware, but if on the children aware part, we have, it's Lawrence Intermediate School here in Lawrence. They do a program every year where they have a FedEx truck come, park, the children get into the driver's seat, and they get the chance to see how they can't see the people standing behind them. So they really try to hit home from an early age that you really aren't seen. So I thought that's the great exercise that they do. They do it part of as a whole little walk-on that they do, but it is a great exercise. We need to reduce the size of vehicles too, but that's a different part of the question.
Yeah, that's a very complicated question there, Sean.
Yeah, I mean, a couple things did come to mind for me. I'm thinking connected vehicles. There may be some benefit from being able to understand positioning and when there is a person nearby. Some of the detection that occur on vehicles as you're backing up when there's an object that you can't see, but it is within that area. Potentially even, front being able to see or not necessarily see, but have some kind of a zone of influence that alerts the driver that there is somebody entering in that area, be it another vehicle, but also being an individual walking. So.
Yeah, and I think a lot of us are learning, we need to build the infrastructure for people to walk and bike safely, not just to school, but in a lot of places. And once you do that, then you reduce the need to drive, and you can, eliminate areas where these large vehicles are interacting with these little tiny school-age pedestrians. I keep thinking about my nephew. I have a picture of him on his first day of school in first grade, this little tiny thing. And you can see a truck parked not far away and how gigantic it is. These vehicles should not be in the same areas as some of these smaller children. We need to do a better job for bicycle and pedestrian facilities, not only around schools, but in other areas as well, so that we don't have to be driving everybody everywhere.
Definitely. It's a great point, Elise. I also just wanted to mention, so something we're working on right now at the Resource Center related to this, Cheryl actually made me think of it, was working on a driveway safety video that kind of gets into some of this awareness about the blind spots, because, rollover crashes in driveways is terribly common, unfortunately. And a lot of people just don't realize that blind spot behind vehicles. And even if you have the best backup camera in the world, if the child's not, as tall as the bumper of that vehicle, they're not going to be seen. So that's something we're working on. Not quite ready yet, but we'll spread the word once that video is out there, just to kind of help spread some of the awareness. So thanks for reminding me, Cheryl.
Sean, that's a really good point that you bring up about the awareness. And think about coming out of a garage and the sidewalk that's in front of the garage, and you really have so many blind spots when you're coming out. You've got parked vehicles on the roadway, obstructing vehicles coming and going. You have pedestrians not being aware that there's an active driveway, drivers not being aware that the pedestrian's coming up. So it is a complicated thing, and hopefully we'll come up with some strategies that'll help take care of that. So.
Yeah, definitely. And, these backup cameras are great. They help, but they're not to be relied on solely, which is something I personally want people to realize as well. I look at my camera, but I also definitely look behind me too. And there are things the camera does not pick up. So it's not a substitute. Yeah. You've really got to pay attention. So that's another point I want to make in this video.
Yeah.
All right, I think I have one last question, and this is something, again, we've all hit on in the presentations. So the safe systems approach, it's very important that, we all be involved. There's a part for everyone. So how do you all feel is the best way to involve communities in the safe systems approach?
I think probably awareness is the biggest thing. Talking about it, making people aware of it. We're sitting with 25 participants here. What is the background of those people? We have breakfast tomorrow that we're probably going to have a little bit more. I think it needs to be talked about. I think it needs to be something that you have a conversation with, even if you have kids at home. If they're aware of it, how many kids can say that they help reduce the number of fatal crashes in their state by being aware and understanding that they also participate in it, much like you were saying. So I think awareness is probably the biggest thing. So talk it up, everyone.
Yeah, and I agree with Amy. I mean, there needs to be a marketing campaign. I mean, it's very sad to look back. In Netherlands, it was that now we'd call it a clickbait headline, but this person happened to have the platform because he was obviously a saddened parent, who was a journalist. So he made that headline, stop the child murder. But that got people's attention, and it changed the cultural norm. And it's what we need to do. Because we don't have enough outrage not just about children, but in general. I mean, why have we normalized it? So I think that marketing, that awareness of this doesn't have to be, I've said, think about, we have trust in our systems. I turn the water on, I don't expect it to be toxic every 2 days, or somebody is going to be impacted by it. I figure I can have fresh water. I think we all do. But why are expectations any different on the roads? And I think that change in thought is going to take some raising awareness and some clever marketing too. I mean,
Cheryl, you really do bring up a valid point there. I'm much older than most of you here, but I can remember a time when people smoked on airplanes, smoked in restaurants. The non-smoker had absolutely zero rights. And who, back in the 70s, you would never think that we would move to a time where you could walk into a park and it would say, this is a smokeless park. You're not permitted to smoke here. Or, I just think it's interesting. And that's how we have to think about this road to zero. You have to believe that we can get there. You have to be part of the solution. And the safe system approach is proven that it'll be the way to make this happen. And naysayers, I say, think about the fact that we used to smoke wherever we wanted years ago, and we no longer are permitted to smoke anywhere. And it just took buy-in and pushing and keeping at it until we got to where we are today. So I think it can happen.
And I think not just awareness of the problem, but also awareness of the solutions, that people are actually making a difference. The Netherlands looks the way it does today because people really fought hard for that. But it is possible, and the examples are right in front of us. Cheryl gave us great examples from Mercer County. Those are the kinds of things we really need to publicize as well.
Yeah,
definitely. I also, someone mentioned youth involvement, which I think is so important as well. And that's kind of a plug for our Safe Routes Academy presentation next week. We're going to be talking about safe routes to high schools. So how to actually involve high school students. And it's so important for them to be involved, but also to be involved as actual partners, not just talked at. So it can be a bit of a challenge, but we want to make sure that we're engaging youth and listening to them, making them feel heard, and also learning from them. Cheryl talked about the school travel plans and going on walk assessments. I have never done a walk assessment with a child where the child hasn't taught me something. They're very insightful, and they're out there walking every day on their way to school. Some of them, not all of them, unfortunately, but they can really tell you, well, we don't do that because this is the reason. So, it's never failed where I've talked to a child in one of these things, and I'm like, oh, I didn't think of that. So it's very important that we involve students, we involve children, and make sure that, it's not just an inform, but listen to. So. All right, sorry, we just got a question in chat. So liaisons are needed within our school districts, whether an elected official or BOE member, or perhaps TMA email the superintendents directly to engage them and raise awareness. So yeah, that is an important point. And we're definitely, and I don't want to speak on behalf of all the TMAs, especially with Cheryl being here, but I know this is something the TMAs definitely do work on. They're looking for partners everywhere. So the TMAs work on the municipal angle, and they're also working with the schools. So this is something they're definitely, and I should probably have Cheryl answer the question or speak on this more than me.
Well, I will say, obviously that's always the goal. It's hard, challenging sometimes, because you do find, particularly as much as, for example, with Trenton, they reached out to us because they want this, but sometimes they have big concerns too outside of it. They're just in the education thing, and so sometimes to keep the sustained interest, they've continued to be interested, but in any school there's testing, there's whatever. Sometimes it's hard to get that champion, but you just have to sort of keep at it, because you do want to have that connection. So a lot of times it'll be the school nurse, who, in fact, they end up being great advocates if you can get if the school nurse is involved, because they are looking at it from the health perspective. So and they're not doing the teaching in the classroom and doing the testing. They're busy. They're giving a lot of meds all day, and there's kids coming down, but it's something they could take on. We've had good success years ago, I know with some with the gym teachers, the physical education teachers, again, because they can incorporate it. But it's really helpful. And, when you get lucky sometimes and you have a principal who's a cyclist, and, and that sometimes it's that. But the point is well taken, that it's really important to have the connection between
and the
them.
Partnerships are important, and there's an important partnership we have with the Sustainable Jersey program, not just the program with the municipalities, but now there's Sustainable Jersey for schools. So schools that want to earn points as far as proving that they're a sustainable school district or a sustainable school can work with that program, and we can help them accomplish their goals by completing certain actions, which include safe routes to school, walk to school days, school travel plans, and things like that. And that program helps us get the word out even more.
Yeah, that's an excellent point, Elise. And it kind of gets back to what we were saying before too, but there's just so many different angles and interests associated with safe routes to school. So that is a great partnership with Sustainable Jersey and Sustainable Jersey for Schools. And it kind of brings people who might not really be thinking of bicycle and pedestrian safety into the fold. They're thinking about sustainability, more environmental issues, but it is all related, and it just further spreads the message. I also wanted to reiterate some of the things Cheryl was saying. So it is challenging to keep these connections going, and it's something the TMAs are great at. But unfortunately, sometimes you'll have a great connection in a school or a community, and that person moves on, and then you're almost starting at zero again. So it's kind of a never-ending challenge, but it's something we all embrace, and we'll just have to keep going. All right, did anyone have any other questions? You can put them in the chat now. And any of our presenters, if you had anything else you wanted to add before we conclude.
I just ask that everybody that is at this presentation really looks at how they can participate in the safe system approach. Choosing to not speed, choosing not to drink and drive, making choices that you would want your children to make, and being an example to them. So I really do encourage you to take home what you've learned here, share it with anybody that you're talking with at the dinner table or happen to have a conversation with, and that would just be my takeaway.
And model that good and healthy, safe, and sustainable behavior, not just for your kids, but for everybody in your neighborhood, everybody in your town. And then when we have successes like this, publicize the heck out of them.
Great. Well, I want to thank everyone for attending this session today, and I want to thank all the panelists. You all did an amazing job. It was a great session. And I also want to remind everybody that we have one more Safe Routes Academy session left, and that'll happen next week, same time, same place. And this time we'll be talking about safe routes to high school. So we're going to have a great conversation, and we're actually going to have some students come speak with us and be part of our panel. So we're going to learn directly from them, their thoughts about the best way to engage them and their peers, and the best ways we can do that. So I think it's going to be a great session. So that's my plug. So be sure that you join us next week. I also just wanted a final reminder that all of our sessions are being recorded, and they're going to be made available on our YouTube page. So if we didn't have time to answer your question, or you think of a question later after the session breaks, feel free to reach out to us at the New Jersey Safe Routes Resource Center. There's contact information on our website, and we'll be happy to answer any questions that come up. So with that, I want to thank the panelists one more time, and I think our session is concluded. Thank you all.
Thank you.
Thank you.